Okay, good morning, everybody here in New York or on this side of the world. We are back with the Happy Hearing podcast. Today, I am Ruth Reisman, a professor and audiologist here in New York City, and I'm here again with my co-host Carly Sygrove, and we also have a special guest. So, looking forward to this episode today, Carly.
Hi, everyone. Welcome to episode 12 of the Happy Hearing podcast. I'm Carly Sygrove. I'm a hearing loss coach, hearing health advocate, and writer. And today's episode's topic was actually inspired by a listener who reached out with a question about whether we could do a podcast on women's health, in particular, coping with hearing loss and hormonal changes. But before we start the conversation, my co-host, Dr. Ruth Reisman, will introduce our special guest.
Yes, thank you, Carly. Yes, we have a wonderful guest today, Dr. Tahl Colen from New York City. She is a prominent ENT physician who specializes in otology here in New York City, working under the ENT and allergy umbrella. And we happen to be great colleagues, and we get to see a number of patients that overlap. But I'm looking forward to her speaking to her experience and everything that she does for the hearing impaired community. Thank you, Dr. Colen.
Thanks for having me. Excited to be here.
It's a pleasure. It's interesting because as Carly was saying, uh, a listener actually reached out to us to ask us about if there's any correlation between, women's health, hormonal changes, and hearing loss. And I thought that was an interesting topic because I do see during different time periods, and I wouldn't know if there's some pattern to it or if there's medical science behind it, but I know I've seen pregnant women that have lost their hearing during pregnancy. I've
Yeah.
seen women going through hormonal changes and menopause and coming back with different types of challenges with their hearing. So I would love to get your insight on that aspect.
Yeah, so there are some interesting things that happen, and they're kind of elucidated by pointing out some of the differences between hormones in men and hormones in women. Um, you know, Men and women make the same sex hormones. So we all make estrogen, progesterone, and testosterone. But obviously, in women versus men, we make them in different concentrations and they affect different body parts. And we also have like different levels of them throughout our lives. And one of the major differences, which I'm sure is kind of obvious between men and women, is that women both have this cyclical variation, right? So during the menstrual cycle, the first half of it, estrogen rises, and that's to get an egg ready for fertilization. And during the second part of the cycle, progesterone rises, which is to get the lining of the uterus ready to receive a fertilized egg. And so there's this cyclical thing where estrogen and progesterone are going up and down throughout the course of the reproductive years. And then during pregnancy, things change, right? So that's like a big increase in both estrogen and progesterone production. And progesterone becomes much more dominant during that time because it helps keep the pregnancy going. And then in menopause, there's like a sudden drop off of hormones, which is kind of like a precipitous change. And in men, they don't have all these changes, right? They have kind of like also like a decline over time, but it's more of like a slow, steady decline. So the hormonal setting is just like really different for men and women. And that has a lot of implications for women's health that, where it's like the up and down aspect of it, where for men's health, things are more kind of predictable. Yeah.
That's interesting. So I guess what would be the correlation to the ear? Because for me, I know, and this again could just be a theory, but I think could it have to do with fluid retention potentially that shifts the fluid throughout the body and potentially impacts the inner ear or something? I don't know, because I do see all of these fluctuations that happen
Right.
throughout, like you're saying, the cyclic period.
Yeah. So, although we think of sex hormones as like having an effect on the reproductive cycle, they have an effect on other parts of the body also, right? So there are receptors for estrogen and progesterone in all different parts of the body. And so these hormones that you are not just involved in reproduction, right? And if you think of things that change with menopause, estrogen has a positive impact on the skeletal system, where osteoporosis becomes much more of a problem after menopause when the levels go down, and also cardiovascular health. So we know that estrogen has an effect on things that are beyond the reproductive system. For the ear, there actually have been shown to have estrogen receptors in the ear. So in the inner ear, in different parts of the inner ear, there are estrogen receptors, and there are some estrogen receptors in the part of the ear called the spiral ganglion, which has to do with nerve conduction from the ear into the brain. And then there are also estrogen receptors in the stria vascularis, which is the part of the inner ear that's like a capillary loop that is involved in the making of endolymph. So that part of the inner ear function is improving blood flow to the inner ear, and also bringing like needed nutrients to the inner ear, which may be facilitated by estrogen. And the amount of estrogen receptors has to do with how much estrogen there is in the body. So the effect on these target organs like the inner ear go up with the beginning of the menstrual cycle, and then are lower in the second part, and also vary in the other parts of a woman's life. So as far as what you're saying about fluid retention, I think that the time when that really seems to be relevant is during pregnancy. So during pregnancy, progesterone is more of a prominent hormone than it usually is. And progesterone is involved in causing edema. And in the inner ear, it can have a similar effect on the cochlear aqueduct as eye drops does. And so it's actually been shown that during pregnancy, women have a decrease in low frequency hearing, which fortunately resolves after pregnancy. And the other thing that was kind of interesting is that the presence of OAEs goes from, the absence of OAEs in the regular female reproductive population is 4%, but in pregnant women, it's 26%. So that's a big jump in terms of like this, outer hair cell function. So those are kind of like the biggest changes that I saw associated with pregnancy.
Mm-hmm.
So interesting.
Very interesting. Just talking about the endolymph, which is, I'm talking from a layperson's point of view here. So it's like the little sac in the ear where it has a fluid. Is that correct, in the inner ear?
Mm-hmm. Yes.
Okay. So for me, I have Meniere's disease. So I have an issue with the fluid in this part of my ear.
Right.
And I have noticed, because I've tracked my symptoms of Meniere's disease,
Yeah.
and I have noticed that my balance issues, my tinnitus, my sensitivity to noise, all of these things do seem to be affected during my period. So is what you've talked about there, so having all these receptors in the ear for estrogen, does that explain why maybe I am having these flare-ups around my period?
Well, I think that when you're having your period, estrogen is sort of like at a low point. So that's the first part of the menstrual cycle, called the follicular phase. And so estrogen is sort of like starting to rise during that time, but it is kind of at a low point, like at the beginning of the period. And progesterone is coming down. So there may be that effect of the progesterone associated edema during that time. It's interesting because the estrogen being at the highest level, which happens at the end of this follicular phase, which would be like, in most people, like 2 weeks after the start of your period, that should be when hearing is theoretically at its best. So they've done studies looking at women in terms of different parts of the menstrual cycle, and hearing is actually at its best. It cycles, and hearing is at its best when estrogen is at its highest during that part of the cycle. So estrogen confers an advantage for that part of the cycle, and it also seems to have an effect on right ear dominance. So there's like an advantage. Right ear dominance is like even more during these higher estrogen points.
Mm-hmm.
Is that
How
why you were saying
interesting.
it is interesting? Is
Yeah.
that why you were saying that women potentially have an advantage with regards to hearing because our estrogen is higher?
Right. So, you know, in looking at this material, I feel like I was kind of brought back to like, what did I learn about this during residency? You know, this wasn't a topic that was discussed very much. And like the good news is really because the changes are not very big between men and women. They're, you know, smaller incremental, smaller kind of decibel changes. But I feel like the things that we talked about were otosclerosis, that there was this idea that like otosclerosis gets worse during pregnancy. And whenever we talked about differences between men and women, it was always like, oh, men have more noise exposure and they're exposed to more like environmental ototoxins, and that's why their hearing is worse. And so in doing kind of the preparation for this podcast, I mostly looked at this really good review study that reviewed a lot of the studies that have been done over the years, the good quality studies looking at differences between men and women and differences between women with hormones. And so there is kind of this theory that it's not just the environmental differences between men and women that make women have better hearing than men, but the effect of hormones. So there's 3 situations that kind of speak to this point. One is women with Turner syndrome. Do you guys know what that is?
No.
Mm-mm.
So Turner syndrome is a genetic abnormality where you're born with only one X chromosome. So you're missing an X chromosome. And women who are born with this don't develop ovaries, and they don't have estrogen. You know, they have very little estrogen production. And if you look at that population, they're like the same as other girls until puberty, but then their hearing starts to decrease right after puberty. And their hearing is more similar to women 20 years older than they are. The second piece of evidence comes from what I was talking about before, where hearing has this cyclical, you know, changes in women where it's highest when the part of the cycle where estrogen is highest, hearing is at its best. Mm-hmm. And then the third part of it is with menopause. So prior to menopause, women have an advantage in terms of hearing over men. Women's hearing is better than men. But then they experience a really precipitous drop in hearing with a change in hormones during menopause. And then it actually reverses where like women's hearing becomes worse than men after menopause. So yeah, those are kind of 3 pieces of evidence saying, no, it's not just the environment that's causing this difference between men and women. It's actually this effective estrogen, which delays age-related hearing loss. And it also actually protects against noise-induced hearing loss.
Interesting. Very interesting.
Yeah.
Getting back to the listener who actually wrote to us and prompted this podcast, she had actually suffered a sudden hearing loss. And I know we talked about sudden hearing loss before the podcast earlier. Yeah. So she's had a sudden hearing loss and she's also going through perimenopause. And she also had that question of, as everyone who's had sudden hearing loss can probably relate, she's looking for an answer. So her question was relating to, do you know if there is any correlation between sudden hearing loss in particular and hormonal changes? Could that be a thing?
So, you know, I did, the only thing I saw that was related to that, and it may just be like that the quality of the studies weren't good enough to be included in this review, was that there was some mention of like women having a little bit of a better spontaneous recovery from sudden hearing loss. But I'll have to get back to you about that particular question. I didn't really see anything that suggested that. Do you feel like you guys see sudden hearing loss more in women than in men? Do you notice a gender difference in your practices?
I was going to say no. Even with Meniere's, to me, it's seemingly 50 chance, right? That I don't see a gender effect really, but
I think I do get contacted more by women. I run a support group, and obviously I'm a coach as well. But I think it's really perhaps that women are more open to talking about it and looking for support and looking for help. It could be, but as with sudden hearing loss, there's a big question mark over statistics anyway, isn't there? And people seeking support and help, and so who knows?
Yeah.
Mm.
I don't mean to go ahead, sorry.
Go ahead.
What were you going to say? You said that you could try to see if there's
I can try to get back to you about that, see if I can help your listener out at all.
That'd be great. Really great.
I have so many questions,
Me
and that's
too.
why I feel like I don't want to dominate the conversation, but I have two questions in particular. One, so I know, similar to how you were saying, in during residency, they discussed how, women have this predisposition or a higher predisposition to having otosclerosis. I've also heard that during menopause, women are also have a higher incidence of patulous eustachian tube dysfunction. Is that something that you've read in that article, or what do you think would be happening there potentially?
Yeah, I mean, I think that makes a lot of sense. I feel like patulous eustachian tube is so rare to begin with. I definitely see it from time to time, and I think it totally makes sense with like loss of like loss of muscle tone around that area. We know that patulous eustachian tube could happen in people who've lost weight. So I think like losing weight and losing muscle tone often can happen with menopause. And the loss of those hormones, that's sort of like, like some of these estrogen and progesterone cause edema. And then when they fall off, right, like our soft tissues get thinner. So I didn't see anything related specifically to that in my research that I did for this, but I think that it makes a lot of sense that it would be more present. I feel like in my patient population, I don't really notice like a predilection towards older people with patulous eustachian tube, but I think it makes a lot of sense that it would be more present. Do you feel like you see a lot of it in your practice?
When working in the hospital, it was a fairly common thing in women around anyone that I was diagnosing with patulous eustachian tube dysfunction, doing testing for the physicians, it's like very much skewed towards women in that age range, mid 40s, early 50s, that were suggesting that they were going through hormonal changes.
And actually, it makes a lot of sense because, one of the treatments that we do for patulous eustachian tube is making a nasal spray out of estrogen and having them spray it in the back of their nose.
Oh, wow. Okay. This is opening up a whole new world.
It is.
And I don't mean to, and I don't know if this puts anyone on the spot, but in my private practice, I do have a large, because we are very accepting of all individuals, all genders. I do have a large LGBTQ plus community, some of whom are transitioning from one gender to the next. And even, those who support the practice at the front desk have commented saying that it's interesting that it seems like these hearing issues, particularly auditory processing disorders or challenges, are often found in these individuals that are transitioning or considering transitioning. Do you think that there's something also related to the central component of it as it relates to hormones? Not just because we were talking a lot about the inner ear. I'm just curious if there's a central component to it.
Absolutely. So there is a central component to a benefit to hearing. And there are some of these hormone receptors in the brain, which again are going to be more present in women than in men. I guess I'd be interested to know, like, if it's a male to female transgender transition versus the other way, and how that affects hearing. It's interesting looking at some of these studies that might relate to that. One thing is that they've looked at ABR, which is more of a measure of central function, because auditory brainstem response measures the signal as it goes from the inner ear all the way up the auditory pathway to the brain. So they've looked at, like, there's differences in wave 1 between men and women. And then there's also differences in wave 5, which is like more deep in the brain. And so they've kind of conjectured that maybe it's because men have larger heads than women. And that's why, like, their propagation of the wave takes longer, and they have longer latencies than women. But they've actually did a study showing matching the head sizes of the men and women in the study. And there's still an advantage for women in terms of shorter latencies with ABR, which, is a better result. So that's just that, some of the things that have looked at central auditory processing. The speech studies, like, aren't that great quality. So there's not a lot of, there weren't that great studies involving other, like, speech and background noise, other things that we might use to measure central auditory processing. And then I guess some of the there are a bunch of studies involving hormone replacement, and this may certainly, like, have some bearing on people taking hormones, whether it's for menopause or whether it's for having had your ovaries removed at a younger age, or I didn't see any studies looking at the transgender population, but I'm sure that there are some similarities. So hormone replacement, like, right, we're saying these things like hearing gets much worse after menopause. So it would be really nice to think, okay, well, should we just be all retaking hormone replacement therapy and keeping our hearing great? And the studies are a little bit controversial and are a little bit in disagreement. So there are definitely some studies, a lot of studies that were reviewed that showed that hormone replacement therapy had an advantage in terms of better hearing than women who are not taking hormone replacement therapy. And it seems to be even more an advantage of women who are taking estrogen-only therapy. The progesterone seems to maybe have a negative impact. Not all women are appropriate to take estrogen-only replacement therapy, especially if you have a uterus. That's not great. And then there was a big study, it's kind of an ongoing study called the Nurses' Health Study that's done like a really, really large population of nurses and looked at risk factors for chronic diseases in women. And the results from that study are, like, a little bit contradictory to what I just told you, where first of all, women who had a later onset of menopause, where you would think that their hearing would be better, their hearing was actually worse the later the onset of menopause was. It's a little bit in contradiction to what I've told you before this. And then the other thing was that in women who have taken hormone replacement therapy for 5 years or more, there's actually, like, a negative impact on their hearing. So it may be that there's, like, a short-term benefit, but it's not clear that that benefit continues after taking hormone replacement therapy in the short term. So I think, studying the effect of hormone therapy in the transgender population is certainly something that should be done, and would be really interesting to correlate with these other studies of hormone replacement therapy.
Sounds like there's still quite a few unanswered questions, a little bit of not sure about the tests and things not lining up, and maybe there needs to be a bit more research into this before proper conclusions are reached.
Yeah,
perhaps. So I'm wondering, how important do you feel is it for women to talk to their ENT or their gynecologist about their hormonal health or hormonal concerns to ensure good hearing healthcare?
Well, when I was thinking about like what the take-home messages from all this information was, I think that yeah, I mean, I think that mentioning it is definitely a good idea, and that it's certainly part of your reproductive health. I don't know how educated, like OBGYNs are on hearing health. I'm sure that there's some component of it in their training, but fortunately, like these differences that we're talking about between men and women are pretty small. They're not huge differences. Um, so that's a good thing. But I think that kind of preparing some of our patient population for either, hey, you're about to undergo, let's say, like removal of your ovaries. This could have an implication in terms of your hearing, so don't be surprised. And the same thing with menopause. I think it's just good to be aware that these things are happening, that they're real, that there's a significant change happening, and that this can have an impact on your hearing. And one thing that was interesting that came up is because women have this right ear hearing advantage, and there are more estrogen receptors in the right ear compared to the left ear, that some people might feel the loss of hearing in their right ear more acutely. And so, kind of being there to support them in that, and explain the reasons. I think that yeah, I think that definitely GYNs should be aware that women may be experiencing more hearing loss and more noticing issues with their hearing as a result of menopause.
Yeah, that
So,
opens up a whole another area of like, I guess, increasing awareness and advocacy. We should do a road show, Dr. Colen, and just go to all the OBGYNs and let them know.
Definitely. We'll
Because
have
hearing health is just
Yeah.
part of overall health, isn't it? Is really what we're saying here.
Mhm.
Yeah. Are you
Absolutely.
noticing an increase in overall awareness surrounding hearing? And I just feel like it hasn't been something that's really discussed on a consistent basis, even with primary care.
Yeah, I mean, I think that in terms of aging and hearing, in the last few years, there has been kind of that explosion of studies where hearing has been shown to be a risk factor for dementia. So I think like in the ENT community and probably in the audiology community, that's become like a bigger part of counseling patients, often in terms of like, maybe you should consider amplification earlier on. So I think that that's something that's come up more recently. Yeah, I think that whether primary care doctors are cued in about hearing sort of depends on their training. And it would be great to have primary care doctors, for example, like promoting age 50, everybody get a baseline audiogram in the same way that they promote getting a colonoscopy. And I don't think that that's as like regimented a recommendation as some of these other preventative things.
But with its connection with dementia, perhaps it should be.
Yeah, absolutely. I think that getting a baseline at 50 is a pretty reasonable thing to do, right? And I think that's right. Some people, I'm sure you can speak to this, Ruth, but like some people really notice their hearing loss a lot more than other people do. And so there are people walking around who don't really realize they have hearing loss, and other people who feel it when they just have something really mild going on. So
Yeah, for sure. I think it's very individualized in terms of the impact on what we would call kind of their hearing handicap. And that would vary from individual to individual for sure. So I guess we always kind of wrap up with a question of how can patients reach you, Dr. Colen? I think that would be a great way for anyone who's really interested in exploring this further, or maybe is experiencing symptoms due to potential hormonal change for whatever reason, whether it's during different periods of life or different transitions. We would love to know how they can get in touch with you.
absolutely. You know what, can I say one more thing before I tell
Of
you that?
course. Yeah.
I just want to give you some more information about one thing I said, because I mentioned otosclerosis, but then I also wanted to mention that there was like a recent big study showing that there's not really a significant change with pregnancy and otosclerosis, which was something that I had always learned about. So they compared women who have not been pregnant to those who've had either one or more pregnancies, and there really wasn't any change in terms of the deterioration of their hearing. And then also that women who had their ovaries removed, so very low estrogen progesterone, really didn't have an advantage over women who were still making these hormones. So anyway, just wanted to put that out there since I kind of, mentioned it, but didn't go through with the answer to that question. Okay,
but then that opens to another question then. Do you think it's more than the genetic component? Because my mother had otosclerosis in both ears. They told her it was because she had the German measles when she was younger.
Right.
I was always concerned that I would get it because I knew there was a genetic component. But
Yeah.
so if we're saying that it's not hormonal, then is it more the genetic factor?
Yeah, I mean, I don't want to say it's not hormonal because it's much more common and twice as common in women as in men. But I think it's just that, that kind of pregnancy piece.
Okay.
So there may be a hormonal component to it, but yeah, the thing with the genetic part is that it's an autosomal dominant inheritance, meaning half of your offspring get the gene, but it has variable penetrance, which means that not everybody who has the gene will manifest the disorder. And maybe that something like the German measles might have been like a instigating factor that could have caused that gene to kind of come into play.
Okay, interesting.
All right, how to get in touch with me is, well, if you want to make an appointment with me, you can do it through our website, which is www.entandallergy.com. My practice is in Brooklyn Heights in Brooklyn. And our phone number is 718-208-4449. Yeah, any follow-ups, you just call and we can speak further.
Sounds great. And we'll put that all up also for everyone to have access to, in addition to obviously from whatever we spoke about on the podcast.
Definitely. It's been so interesting speaking to you today, Dr. Tahl Colen. Thank you for coming and answering our questions. And if you think of anything after the podcast that you want to add, let us know and we can write it in the show notes.
Okay, great. I'm going to do that. Thanks so much for having me.
Thank you so much.